What's going on, everyone? Happy Thursday. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, flu test, RSV, maybe it was norovirus or some other test for a virus, I hope you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Thursday edition of the Virus Update for Thursday, December 19th, 2024. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of different viruses out there, and you need to be informed with what's going on with each and every one of these viruses by knowing the levels and knowing what's changing with these viruses. Viruses such as COVID and others can have different variants and mutations that can change over time, and these different variants can do different things. So you need to be informed on all this because, you know what? The news, the government doesn't really do a good job of doing it. That's where I come into play. So if you're new to my channel, subscribe down below, give this video a thumbs up, hit that notification bell, share this video with anyone you know, and of course, leave your comments down below. Already, we do have several news stories to get through today. Then there's some data we're going to look at, some of it being weekly, some being COVID cases for different states. And plus, I do want to take a look at wastewater today because there are some concerning things starting to appear with wastewater. Yes, some areas are just not doing oh so well. But before we start today, I have to share something with you. I was going to show this a little later. I'll share it with you now. You may notice there's no headset on my head today. That's because we are trying out a new microphone. I went out and bought a new microphone yesterday. The old headset I was using finally started to kick the bucket. I didn't realize that until after I posted yesterday's video. I said, wow, that sounded bad. And a lot of you guys said that sounded bad as well. So we're trying out this new microphone. You may see the levels change a little bit from day to day. I'm still figuring it out. And of course, my voice itself, there's nothing that can really be done with my voice. It is what it is. It sounds canny sometimes. But I hope this sounds better. We did a weather video earlier, and that did, to me, sound a heck of a lot better. Alrighty, let's get started, shall we? Louisiana's human bird flu case. Yeah, this is not good. This is an update. The bird flu case in a human in Louisiana is now listed in critical condition with severe respiratory illness. Not a good thing whatsoever. And we do have more bird flu news. This came in yesterday after the update that we did. And this is in Los Angeles, California. New. 2 cats in Los Angeles have died from suspected H5 bird flu after eating raw meat. A third cat is sick. This comes less than a week after 2 other cats in Los Angeles died after drinking raw milk. Both cats did test positive. And I'm going to be doing something on my site. I'm going to be doing 2 mega threads going forward. I don't know if I'm setting it up today, tomorrow, or at some point next week, but I am going to be starting a thread 1 nationally for all the human cases and updates on that. And 2, I'm going to start a separate thread for California where all things H5N1 California are discussed, and all things H5N1 human cases would be in the other threads over on my site, datareport.info. It is time. We just need to keep an eye on this, and hey, you guys can join in on that discussion as well. Create a free account. It is datareport.info. It's a forum website. Anyone can join in on a conversation. It will always be free. All right, Wisconsin we go. Norovirus is the problem there. Norovirus cases are rising in Wisconsin with a 19% positivity rate in late November. Yeah, that's really bad. That's just a really bad positivity rate, and it just continues to go up. That's up from the previous rate that was 12.8% and 9.6%. Yeah, it just rapidly went upward in Wisconsin throughout November. Sticking with a northern state, Nebraska now reports its first pediatric flu-related death of the season. Not a good thing. Probably will not be their last one either. And by the way, in case you're wondering, here is my website, datareport.info. You can look at all different kinds of stuff. You can even do research on COVID studies and papers, and let me tell you something about that section. There's going to be a lot more studies coming in the future. We are constantly learning new things that COVID can do each and every day, and I think I'm going to be starting a new section down below for COVID studies and papers of maybe other viruses as well. Maybe that's something that's needed for these, different viruses like H5N1. It would probably just have a section, maybe some subcategories. I don't know how it's going to go, but I think I am going to do something for that because in my feeds on both X and on Twitter, I'm constantly seeing studies on other viruses posted, and you know what? They need to be archived as well. Moving on to this now, speaking of studies and archives, I saw this over on Blue Sky. Older adults recovering from COVID-19 face a 58% higher risk of developing dementia compared to those uninfected, with rates peaking 12 months post-infection. Study reviewed 11 studies, 940,000 cases, 6.8 million controls. Early dementia prevention is crucial. Not a good thing whatsoever, and I do know people who are now dealing with dementia post-COVID infection. I have a neighbor, and they're not linking it to COVID, but he did not have it before COVID infection, and he's had COVID more than once. All right, up in Alberta, Canada we go. Respiratory viruses spark wave of sick kids at Alberta Children's Hospital, and get this, AHS has added 37 beds to deal with the influx of patients in Calgary. Yeah, that is sounding really bad. Sticking with Canada for a moment, the viral activity level of COVID-19 is now listed at moderate, flu A is listed at moderate, flu B is listed at low, and the viral activity level of RSV remains at high at this time. Alright, taking a look now at what is going on in the UK. We did get the Thursday update of the viruses there. We're not just going to take a look at COVID. We're also going to look at the other viruses as well. I sometimes forget to do that. Taking a look at COVID cases. They just dropped ever so slightly. Basically remained flat, down by 17. 1,069 cases reported. Deaths, 107. That is up by 8, or 8.1%. And healthcare patients admitted, 1,085. That is up by 16. So again, they basically remain flat. Just that slight increase in deaths and the slight drop in cases. That is actually some really good news that they remain flat. Historically, they would be rising at this time. But again, I do have a note here. Remember, we have LP.8 and LF.7 that we need to keep our eyes on. And they may come into the picture. Those two subvariants may enter the picture just past the holidays. So a lot of question marks do arise when we come to January. And I'm seeing the COVID modeling experts starting to say, yeah, they're uncertain what's going to happen in January as well. I don't know if it's LP.8 that's causing that concern for them, but it's definitely something we have to watch because you saw yesterday, western portions of Australia is now starting to deal with complications of rising COVID cases. Again, don't know which particular variant is causing that. All right, also in the UK, we can take a look at influenza, and they are getting hit really hard with influenza. In fact, the positivity rate for influenza in the UK is 17.7%. Yes, and healthcare usage is up big time. Am I seeing this correctly? It's up by 50.6%. Wow. Look at the positivity rate here. It has just skyrocketed from November into December for influenza. Yes, this is really bad. I'm not seeing if it's influenza A or B. I'm just seeing influenza in general. Healthcare usage, that has gone up as well. And this is for all age groups. And it says weekly overall influenza hospital admission rates per 100,000. Yeah, that's skyrocketed. Not seeing deaths listed here. But, yeah, this is not good whatsoever. We can also take a look at RSV. Let's do that as well. And RSV did go up big time in November in the UK, but then that peaked as we started to enter December, and that is now dropping, thankfully, unlike what is happening with influenza. We can see healthcare usage has dropped some as well. So there's the latest update on the viruses from the UK. Now let's take a look at what's going on with air quality levels here in the United States. And you're going to see there are some problem spots, California being one of them. There are actually air quality alerts up for portions of central California today. I don't know why this is not coming up, but there are some areas that are dealing with problems in the west and a few in the Great Lakes as well, last I checked. Want to learn more about the climate and weather? Well, we just did a video over on my YouTube weather channel. Yes, using this new microphone, which I'm really liking so far. Anywho, I did a video update there, which includes Christmas Eve and Christmas Day forecast, and the whole holiday period altogether between Christmas and New Year's. It's looking really unsettled for a lot of places in the United States. Want to learn more? Go check that out. Philadelphia yesterday reported 823 EMS incidents. That's the total number for yesterday. Taking a look at what's going on right now in Montgomery County, Pennsylvania, just outside of Philadelphia. And we see that there are a few calls. It looks like there are 10 active calls. Things, though, have been much busier today in Chester County. It's been pretty much consistent all day long. I've been seeing a lot of sick person calls, a lot of respiratory difficulty, and you know what? I've seen a lot of calls for cardiac arrest today. Here's another one now, East Nottingham Township. And just above that, we see heart problems, multiple sick person calls, we're seeing respiratory difficulty. Yeah, it's a busy day in Chester County, Pennsylvania. Let's see what's going on with the hospital situation. I need to refresh this. And you know what? Some good news today. Hospital capacity in southeast Pennsylvania. Not getting a lot of use, but again, there are some grayed out hospitals not reporting here. And I do question what is going on with the ones in Abington Township. Reason being, I'm going to show you wastewater there for a little bit. Not good news there. Not good news whatsoever. Lehigh Valley is still, a lot of hospitals there today look to be busy. Moving on and checking New Jersey now. And I forgot to add a story. There was a healthcare system in New Jersey. I'm trying to remember what it was called. It may be this RWJB. I forget. I'm going to make sure I queue the story up for tomorrow. They're actually reinstating mask mandates just because of the surge in respiratory illnesses in their areas that they cover and their health care systems. So, that is something. It's a good thing. It's really interesting. It's something you almost don't expect to see. The Valley Hospital looks like it has a diversion for patient volume. 2-hour diversion until 1,400 hours. Alrighty, taking a look at Pennsylvania. We did get an update today on Pennsylvania wastewater. We can see there are actually a few drops now, but you're seeing more increases show up. You're seeing one out near Pittsburgh in Allegheny County, Pennsylvania, Cumberland County, Pennsylvania, York County, Pennsylvania is going up. Dauphin County, Harrisburg, that's the capital of Pennsylvania, that's starting to go up. Westchester's going up. And let's pause for a moment. Abington, Montgomery County, Pennsylvania is not only going up, they just did something that, if you listen to some COVID modelers, you wouldn't expect it to happen in your area, but it did in this particular area. Concerning to me because I live right next to this area, so this is not good. Abington Township, Montgomery County, Pennsylvania, as I tweeted, just passed its summer peak. Take a look at this. Yeah, look at that. There's the summertime. There's where they are now. It is just skyrocketing. And this is something we are seeing happen in areas that did not get hit as hard in the summertime. Some areas got hit really hard in the summer. And they somewhat did, but take a look at this. This is higher than their summer peak. This is something we're seeing happen up in the Midwest, the Northeast. Well, you'll see what's going on in other parts of the country in just a little bit. So that's Abington, Montgomery County. Going back to Pennsylvania for a moment, we do see that there are decreases now in portions of northwest Montgomery County and Armstrong County. Is that Armstrong County? Or Westmoreland County, it's right on the border. It's seeing a decrease. Center County, Pennsylvania, increase there. And I looked at the charts. It is starting to increase. That's going to be an interesting one to watch because they have the first ever playoff game for college football there this weekend. That should be probably a sellout crowd. And Lehigh Valley, Allentown, you're seeing an increase. And Lackawanna County, Pennsylvania, is also seeing an increase at this time. Walgreens COVID positivity rate this week, 15.2%. And that is even from last week. We'll have to watch that going forward. All right, let's take a look at some wastewater data. We're going to go region by region versus going on an individual wastewater site today because, well, we need to look at this. First off, nationwide COVID levels. They are now starting to rapidly rise, and that should continue for the next couple of weeks, at least until the first week in December. There should be a peak. What happens after that remains uncertain. Again, LP.8 and LF.7 at some point will enter the picture. What they will do remains to be seen. And RSV at this point, that's rapidly rising as well. I actually know someone who's currently dealing with a severe case of RSV. It's not sounding good. I hope they have a full and speedy recovery. Influenza A is rapidly rising at this time nationally. Influenza B is rising. HMPV, very low, but is rising. Norovirus is rising. And everything else is not much of an issue at this time. Now going region by region, and we can see here, COVID in the Midwest has just rapidly gone off. Even if you take away that wonky movement, again, it has rapidly gone up. RSV has dropped some at this time, as has Influenza A. Influenza B is low. HMPV is low. Norovirus, as noted the other day, continues to be very high. In the Northeast at this time, COVID, it is listed high. It is continuing to rise at this time. RSV is now very high. And take away that wonky movement, it's probably still rising. Influenza A is going up. Influenza B is low. And taking a look at HMPV, low but rising at this time. Norovirus is listed high and continues to rise at this time. Now, here's something that is new that you did not see in the other days, and that is the South. We're starting to see a rapid rise for COVID in the South. Normal as you get closer to Christmas, but this is pretty significant. I mean, look at that. The curve, the bend. Yeah, it's almost starting to go straight upward. Something I'm not happy to see. Wonky movement at the end. That will be corrected. This could continue. We'll really need to keep an eye on this. RSV at this time, very high in the South. Influenza A remains low, but is rising. May go medium pretty soon. Influenza B is low at this time. HMPV is low. And Norovirus, it continues to trend high. It is high and continues to trend upward at this time. Now taking a look at the West Coast, which, remember, the West Coast got hit really hard in the summertime. They have been gradually rising, and they're still listed at low for COVID at this time. RSV is running high and still rising, unfortunately. Influenza A is running high. It did look like it tried to peak. Now it's starting to go up once again. Influenza B is low and rising. HMPV is low at this time. And Norovirus was very high. Most recent update, which is, it looks to be a wonky one, maybe going back up again. We'll see. Hopefully not. Hopefully it peaks and starts to drop. Alrighty, let's take a look at some data now from CJS 83172. But before we do that, my reminder I'm going to give you every day until we're through with the holidays. If you're positive for COVID now, chances are you will have to miss Christmas and holiday gatherings because you still will be sick. And at this time next week after that, I'll be saying, if you become positive, you'll have to miss New Year's Eve and New Year's Day festivities. Let's face it, if you're positive, it's not really enough time to recover. You could still be infectious. You could give it on to someone else. And if you're sick with another virus, yeah, chances are that could cause you to miss the holiday as well. I'm sorry. I know it sounds cruel. I know it sounds mean, bad, but do you really want to risk getting another family member sick? I don't think you do. All right, now that data from CJS 83172. Florida, daily numbers. 399 new cases and 14 new deaths. New Jersey, weekday, 639 new cases and 2 new deaths. 37,164 total deaths and a cumulative deaths per capita rate of just over 4,000 per million people. New York, daily yesterday, 839 new cases. Hopefully we get New York for today. We're going to be refreshing it when we get to that, because as of the start of this video, it was not updated yet. Puerto Rico, 128 new cases. Arizona, 2,195 new cases and 21 new deaths, all within the past 3 weeks. Hawaii, weekly number, 164 new cases. Nevada, weekly number, 228 new cases. Oregon, weekly, 290 new positive tests, a test case positivity rate of 3.2% this week, and 6 new deaths. South Dakota, weekly, 528 new cases and 1 new death. Tennessee, weekly, 1,670 new cases and 8 new deaths. Washington, weekly, 226 new emergency department visits and 8 new deaths. Reminder, the Pacific Northwest is not seeing a significant increase as of yet. All right, drum roll, please. I need to refresh New York State. Hopefully, it did come in. Wow. Remember, it's Thursday. They do add in New York City data. There's an increase over last week. 1,075 new cases. First time over 1,000 cases since... I have to go back and find this here. I'm pretty sure it's October. Let's see. Yes, October 7th. So, I mean, it should be no surprise. It's to be expected, and they're still doing a lot better than last year at this time. Let's also refresh hospitalizations, and it does look like that's on increase today as well. 542 people hospitalized, 63 people in the ICU. The wild card to watch, will they have the first Christmas period, New Year's holiday wave without any 1,000 hospitalizations? We can hope that will happen. We'll just have to wait and see. All right, just a couple more states, then we're done. Unfortunately, no Ohio, because it's only 1:21. Ohio doesn't update till precisely 2 o'clock in the afternoon. We'll get that in tomorrow's update. Taking a look at what's going on in Colorado. COVID weekly hospital admission count, 121, that's up by 1. Influenza, 75, that's up by 14. RSV, 68, that's up by 23. Weekly diagnosed emergency department visit percentage, 0.85, that's down slightly. Influenza, 1%, just over 1%, that's up slightly. And just over 0.1% for RSV. Now, this is not good. Weekly positivity rates for COVID is 8.21%. That's up by 1.25. Influenza is up by over 3.5% to 8.14%. RSV, 4.41%. That is up by 1.5%. Taking a look at what is going on now in the state of Washington, and we can see here, emergency department visits for influenza now at 2%. That is an increase. That's up by 80%. RSV up by 20%. Percent of hospital admissions is 1% for COVID, influenza, and RSV at this time. Average number of ICU beds occupied, less than 10 for both COVID and influenza. Data not collected for RSV for some reason. Alrighty, folks, that does it for the Thursday edition of the Virus Update. Let me know down below. Do you think this mic is better? I think anything is an improvement over before, and mind you, some days my voice is not always the best. That's part of the problem as well. Nothing I can really do about that. Some days it sounds like I'm losing my voice. I mean, I don't know if it's long COVID, it's just my voice, and I do drink plenty of liquids. I don't know what to tell you, but I do think this is definitely an improvement, because I went back and listened to my weather video, and I said, boy, that sounds a lot better than the mess from yesterday when we did yesterday's virus update. So let me know down below if you enjoyed this video. Give it a thumbs up. Subscribe if you're new down below. Yeah, maybe more people will be inclined to do that with a better microphone now, because let's face it, I saw the complaints. I get it. And we hopefully solve the problem for the time being. So subscribe down below, hit that notification bell, share this video with anyone you know, leave your comments down below. I'm sure there's going to be a ton of comments today. Thanks for watching. I'll see you all again tomorrow, where we'll have new data from the CDC and, of course, any news that does pop up. Thanks for watching. Enjoy the rest of your Thursday. See you again tomorrow.